Okay, let's get started. Hi, I'm Val Wolf. I'm the Executive Director of the Hamilton Clinic for the Occupational Health Clinics for Ontario Workers. I often skip over introducing myself, so I thought I'd do it today. Thanks for joining us for the fourth in our series, our Mayday series on workplace mental health and injury prevention. And today's section is considering key issues, violence, pain, and surveys. I'm really looking forward to the discussion and to hearing about some of the new resources that are being developed, as well as John's presentation on what we need to keep in mind when we do surveys. So we're going to start with Kristy Cork from WSPS, and she's going to talk to us about the workplace violence risk assessments, new and improved tools. And she's got a couple of poll questions for us, so we'll be interested to see your answers. And I'm going to present for her.
I'm here.
And
can you hear me?
Yep. Well,
I just lost power. I am so sorry.
Oh, no worries. We just did the segue over, and it's okay. This is
okay.
Hopefully that didn't cause undue poor workplace.
It was very stressful. I'm on a hotspot on my cell phones to get internet, so I'm just hoping that there's no additional issues. But yeah, okay. Oh my gosh, my lights just came back on. Okay. Thank you, Val, for the intro and for pulling up the presentation for me. So what we're going to be talking about today is around workplace violence risk assessments and an initiative that the Prevention Works Committee took on as a project in WSPS is taking sort of a lead on, is to develop a new tool to assess the risk of workplace violence. So Val, I'll get you to just sort of scroll past the next disclaimer slide and get right into things. Perfect. So the current state, so workplace violence and harassment and that work-related mental harm reduction, they continue to be a priority focus area for the Ministry of Labour, Immigration Training and Skills Development. And we see this with various communications that come out, and certainly it's been communicated to us as system partners that that is an area of focus, that we need to have dedicated sort of project and be working towards sort of minimizing those hazards in Ontario workplaces. So there were OSHCO tools. When the legislation was first introduced and the Occupational Health and Safety Act, identified that workplace violence and harassment were key hazards in Ontario workplaces and created legislation that required Ontario workplaces to not just have a risk assessment, but to have a policy, to do training, all of those things that we know are in the Act. But that was launched back in May of 2010. So these tools now are quite dated, and we know that the way that we work, what we do, how we work has changed, and certainly the hazards around workplace violence and harassment have also changed, right? Like a lot has happened. We're working more virtually now. Our interactions have changed. COVID changed things. So there certainly is a need, and it's been identified that those tools are maybe no longer serving all of the sectors in Ontario. So we have a bit of work to do to revise, revamp those tools to make them user-friendly. And we know that incidents continue to increase. This isn't a hazard that has gone by the wayside and that isn't an area of concern anymore. Maybe the next slide, Val, will sort of highlight this need a little bit more. So in 2022, there was a survey that was conducted, collaboratively with Western University, the University of Toronto, and the Canadian Labour Congress. So this is a brief summary, but certainly if anybody wants an access or a link to the exact survey and all of the details in that survey, I will put my email in the chat when I'm done presenting, and I'd be happy to share that with you. But essentially, the summary of the data spoke to over 70% of nearly the 5,000 respondents have experienced at least one incident of workplace violence or harassment in the past 2 years. Now, I don't know about you, but when I read that, I was shocked. I couldn't believe that that was the percentage, at least of this select group of individuals. And I know John's going to be talking about surveys, so maybe he has some issues with how this survey was done or the effectiveness of it. But either way, that is a very high percentage. And this is across various sectors. So this isn't just the service sector or the healthcare field or education field. This includes manufacturing, includes retail, includes many different sectors. And it identified that third party and coworkers or colleagues were the most common perpetrators. So there's a lot of interesting data that can be gathered from this survey, but the key takeaway is that this continues to be a top hazard in Ontario workplaces for workers. And the effects of workplace violence and harassment are not just the immediate sort of physical injuries that maybe we sometimes think about related to workplace violence, but certainly the psychological impacts and psychological injuries that occur when people continue to be in situations where they are aggressed upon physically, verbally, emotionally. So some other studies have indicated that across the board, there's an increase in severity and frequency. There's also this increased fear to report and fear of retaliation. So this is one thing that we really do need to look at is why are workplaces or workers not reporting this? Because I guarantee if we went and talked to workplaces in Ontario, they would not identify with this 70% because these incidents are so underreported. So if workplaces don't know about it, if people are not reporting it to their employer, then certainly how are employers supposed to recognize that this is a top hazard and what's going on and invest in resources to minimize that risk if they're not aware of that percentage or how it's impacting their workers? It also identified that there's new harasser tactics. And I think this also speaks to how work is changing, that we're now maybe in a more virtual environment. There's more cyberbullying, leaving people out of communications and things like that, because maybe we have some of that, some less and less face-to-face contact with each other and with customers. Okay, Val, next slide, please. So I have our first poll question here, and I do, and Val noted it at the beginning, that first OSHCO tool, it should be OSHCO. I think I was getting confused with like OCAO and all of the acronyms that are involved in health and safety language. But the first poll question, and I think Tony's pulled up a Slido here for me, thank you. What tool does your workplace currently use to complete a workplace violence risk assessment? So you can select any that apply. But essentially, are you using the previous OSHCO tools? Do you have your own sort of corporate template that maybe has been passed on from, um, your larger organization at a corporate level? Did you create your own workplace violence risk assessment or other? Maybe there's another place that you sought out that information, or you don't know, or you have not completed a workplace violence risk assessment. Oh, sorry, the correct acronym is OSHCO. So that was that 2010 one that I mentioned a couple slides ago that was created in anticipation of the legislation coming into effect in Ontario. And that tool is still widely used. We still, provide it as a resource for customers as well. Okay, so if anybody wants to go ahead and just answer, and we'll take a look at those results. You do have to hit send at the bottom. So once you've selected on that Slido, you just have to hit send at the end, and then we can sort of see what, and it is anonymous that nobody else will see your, oh, wow. So we have a pretty even split here. A lot of people have a corporate template or you've created your own. Some people are not sure or are using another tool, and less are using those existing OSHCO tools. The good news is it looks like most people, maybe with the exception of a couple, have completed workplace violence risk assessment. So that's good. And I should mention, maybe before we move on, the reason I'm sort of selfishly asking you these questions is because we are taking on a project and we're doing some research to figure out sort of what tools people are currently using, what's working, what's not working, so that when we go into developing a new tool, we want to make it as user-friendly as possible. We want it to meet the needs of Ontario workplaces. So I do have another question coming up too to try and get a little bit more information out of you, but that is what we're trying to do, and that's why I'm asking those questions. Okay, so thank you for responding to that first Slido poll. I appreciate it. And the next slide, please. Okay, so WSPS is leading a project to create a simple, easy to use, and updated tool. So we've been in consultation. WSPS has an advisory committee that actually focuses on workplace violence and harassment, and it is represented by all different sizes of organizations and different sectors. So we are working with that advisory committee to try and understand the needs of Ontario workplaces. Our focus for year one really is to focus on simplicity and to view this tool through a small business lens. We need to make it easy to use. There are still a lot of businesses in Ontario, specifically small businesses, that do not have a workplace violence risk assessment. So understanding that there are some barriers for workplaces to get that work done, what's happening, maybe they're not even aware of the legislation, or that there are templates to use, or they just don't see it as a priority. But either way, the tool that we're working on really is focusing on being user friendly, being accessible. You don't have to have, a PhD in health and safety, not that that really exists, but to be able to complete this tool. So anybody should be able to pick it up, to use it, to click on it, and make a difference or assess the risk of their workplace violence and harassment hazards. Now, our timeline is that a pilot should be, our goal is to have that ready to be launched at sort of the end of fiscal in April of 2025. So we are going to do some validation. We are going to do some other work to try and, come up with a product that is, within scope and, with, meeting the needs of, again, those workplaces that we're really focusing on. And then the idea is going into year two, we'll do that pilot, we'll make any adjustments as necessary, but we will launch a free tool that will be available to all Ontario workplaces. Now, I should mention, if you're wondering like what tools exist, certainly that previous OSHCO toolkit is still available. But I should also mention that there's some other ones out there, like PSHSA has done a really good job of creating some workplace violence risk assessment tools specific to healthcare. So there's a fantastic tool for healthcare if that's the industry that you're in, as well as education. And they just recently launched their education specific tool. So there are some really good tools out there, just depending on, again, some of them are sector specific. But if you need more information or you're looking for additional resources, I will again put my email address in that chat so you can reach out and I can share with you, what I know and what's available. So don't start anything from scratch. Hopefully there is something that will meet your needs. All right, next slide. So the second poll question I have here is, I'm curious what you think. And again, maybe it's not a barrier for you at your organization, or maybe you have struggled, but thinking about Ontario workplaces, what do you think are the barriers for workplaces to effectively complete a workplace violence risk assessment? Again, we've worked with some Ministry of Labor inspectors, we've talked to different organizations, all different sectors and sizes, to try and really figure out what these barriers are and why workplace violence risk assessments, first of all, sometimes they are completed. They're done. There's a piece of paper in a binder that is a risk assessment. So when the ministry shows up, they have something to show them. But it's not really effective in minimizing those risk of hazards or helping to identify and implement controls. So what do you think are the main barriers? Is it that the tools right now aren't great? They're too complex? Maybe there's just a lack of knowledge or understanding. Maybe it's a lack of enforcement. No one's coming and knocking on your door to ask for your workplace violence risk assessment. So it's just not a priority. So if you can go ahead and just answer that question for me, again, selfishly being part of our research gathering here as we work on this. Okay, I'm going to wait for a couple more responses to come in. Or maybe there's something else that isn't an option here. You can go ahead and put that in the chat too. I'll take a look at the chat and see. Okay. All right. So let's see. Oh, okay. So thank you for everyone for responding to that. I know, it is a combination of a lot of these different things. And again, depending on the organization, the size of the organization that you work in, the resources, some people have, very robust corporate health and safety policies where it would never be an option not to do this because someone at a corporate level is coming and knocking on your door. Um, but we do want to remove these barriers. We do want to make sure that it's not just a, pencil pushing exercise where we're doing these risk assessments, once every 3 years, and then it sits and collects dust in a binder. And that's sort of what the ministry has told us as well, that they want this to be a tool that is easy to use, easy to update, because it does need to get updated, right? Work changes. Certainly every organization should have revisited their workplace violence risk assessment during COVID, right? Because the way we work changed, especially if you're dealing with customers and interacting with the public. Maybe you put in barriers like plexiglass barriers, and that needs to be updated as one of the controls or the access that people have to staff. Maybe security has changed at your organization. All of those things, right, require the workplace violence risk assessment tool to be updated. Even if you have people now in home offices, or maybe they're going out into the public, or the way the interactions with the public have changed. So again, it's really important that those risk assessments be reviewed, be updated more often than I think they currently are, just so that they stay effective. Okay, next slide, please, Val. So I did leave a bit of time, about 10 minutes here before the next person needs to jump on. I just wanted to open it up for some questions, and I guess just a bit of communication, like what are you looking for? I would love to know, what's going on with workplace violence risk assessments at your organization, what's working, what's not working. If you have any ideas, if you want to be part of sort of a pilot group, then please let us know, because this work is continuing. We're still in the research, sort of literature review phase. Um, so if there are any questions, any ideas, I'd love to hear it.
I don't see any in the chat right now, but I'm interested. It's a good reflection for me because we've used the OSHCO tools and the PSHSA tools
Mm-hmm.
in the past, but I would actually, I'm not sheepish about saying we have not used them since probably a few years before the pandemic. So they're very physical location based. And I wondered if you, in your experience at WSPS or with some of the workplaces that you've already engaged with, have looked at like how does one do this kind of thing when each individual works in their own home and faces a myriad of situations there. Have you dealt with that at all, even internally at WSPS?
Yeah, you know what, Val, it's really interesting. And we've had a lot of questions even from customers around specifically the topic of domestic violence as it relates to workplace violence when people are working out of their own homes. And this generates a lot of conversation because, we're told, and we were told in the pandemic, that home is the safest place for everyone, right? It'll keep us safe from a virus through the pandemic, but it is safe and secure, and you can lock your doors and all of those things. But when someone else that might be in the home is putting someone at risk for, in a domestic violence situation, is that considered workplace violence if they have a home office? So we've reached out to the ministry around some of these questions, and certainly, every situation is unique, and the ministry does not enter people's private residence to do
Anything?
inspections and things like that. But what we were told is that that duty to accommodate still exists. So if they're aware of a situation where someone has put their hand up and said, yeah, I'm not safe at home, I am a victim of domestic violence, and they're reaching out and they're looking for a safe work plan or looking for alternatives and accommodation, that it would be expected that the employer take necessary steps that are reasonable for the safety of that worker and to allow them a safe work environment. So those are different things that have sort of come up. It's not that easy, right? It's not a cut and dry black and white situation. And, again, when we work from home and when we talk about things like cyberbullying and different types of abuse that can happen virtually or on the phone, if you're a call center operator, things like that have to be considered in your workplace violence risk assessment. It's not just that sort of physical interaction with colleagues, coworkers, and customers and third parties, right? It can be so many other things now because of how we work.
Thanks. I don't
Are
know
there
if
any
anyone
other?
else on the call. Sorry, I got distracted because I just got an email that says people don't all have the link, so I'm going to paste it in the Eventbrite. But yeah, I don't know
Oh,
if anyone
okay.
else on the call has any comments on whether they've been able to post-pandemic add a work from home dimension to their workplace violence, not necessarily specifically around domestic violence, which is even, more challenging and more fraught, I guess, but even in the environment and any sort of crime prevention elements
Yeah.
kind of thing in someone's work situation. I don't know if anyone on the call, and I'm just going to go over to my Google
Yeah, I
Drive,
mean,
paste this
unless
link.
anybody else wants to chime in, but it is an interesting topic, right? Because the current OSHCO tool does have sort of those high risk areas, right? Where we dive in a little bit deeper. Let's say someone does work in a high crime area. That is one of the questions, right? Where we have to do a bit more investigation and answer a few more questions, or if they have remote work environments, right? One of the things, or even working alone, right? Or in isolation can
Mhm.
increase the risk. So that's something to consider, right? We know that part of your workplace violence risk assessment and the program has to identify how your workers are able to summon immediate assistance. Well, that's one thing when you're on a factory floor and there's hundreds of people around and you have sort of an emergency SOS button or on a radio, things like that. But it can be quite different when you work remotely. So some of the things that, just as a tip that our workplace has done, because we also travel quite a bit as consultants, is on our work phone. So this is my Samsung work phone. If I hit the power button 3 times, it sends an immediate SOS to who I've set up as my emergency contact. So I have my manager and my husband, and it gives them my exact GPS coordinates, and it takes a picture of the front camera and the back camera and sends to them. So that's one of the things that we've set up, recognizing that we have so many staff working remotely. We don't just have a physical head office that everybody goes to every day. So if we are ever in trouble, obviously 911 is an option, but there's other ways to get help as well. So that's just one of the tools, but we need to leverage technology, right, to make it work in this, new way of working and remote work environments.
That's brilliant. I don't know if
I
people.
see
I
Kathy's got a question here.
go ahead.
Is there still lots of training offerings on the older tool? Just wondering if people still know about the tool and the expected risk assessment required under legislation. So my understanding, Kathy, and the work I've recently done with customers in this area is there's not a lot of training on how to do a risk assessment based on the previous OSHCO tool. However, workplaces do know that risk assessments are required under legislation. But that previous tool is just one type of risk assessment and one way of doing it. The ministry doesn't say you have to use this tool, although it is still the link provided is based on that tool. So no, I wouldn't say there's a lot of training on how to complete it. In fact, we still get a lot of requests and consulting requests to go in and do risk assessments for organizations. And we're still sort of using a modified version of that tool at WSPS as well.
Do you know if iPhones have the same emergency contact possibility as the Android system does?
Yeah, so there are options setting up an iPhone, and we worked with a customer that their work phones were iPhones as well. So instead of just emergency being 911, that's still an option, and it should still be an option on both devices. But there is a way that you can set up emergency contacts on an iPhone or on an iWatch, like an Apple Watch.
Hmm.
So that's something to consider as well, right? Just again, looking into that technology and seeing what's available and using that as a means for workers to summon assistance, because often we have our phones in very close proximity to us wherever we're going, if we're walking in a parking lot, things like that. So again, it does just give one other option for, it doesn't prevent violence, I'm not suggesting that, but it is one other way of making sure that we can summon assistance.
Interesting. I worked with, I don't know if you've ever worked through the tool CEPTED, Crime Prevention Through Environmental Design. That's when I used to work at a university. It was developed actually in Scarborough. But
Mm-hmm.
it's another tool. It's around, like, that's all about external perpetrators or you know what I mean, people that you don't know. Whereas of course
Yes.
harassment And a lot of workplace violence can be from people you do know, or from your customers, I guess, or others that you encounter. But it would be great to find something to integrate all these different tools.
Yeah, and when I worked in healthcare at the hospital, certainly we use tools like that as well because there are some workplaces that are, have very strict security and it's like Fort Knox and hard to get in and out, and the risk of perpetrators or external individuals to the organization is not the highest risk because they
Right.
certainly are not allowed access. But there's so many workplaces that are public, right? And that's why when you can't lock things down and things are open 24/7, that you really do look at that external, like physical environmental scan to see, are there hiding areas? Where are your bushes, trees? Are there blind spots? What does that look like? How do people access different areas? And would you know if someone was there? So absolutely, that physical inspection is just as important as considering sort of a coworker, colleague, perpetrator.
Mm-hmm. Thanks. I think we should probably move on to the next talk, but this is
Okay.
excited to see the new tools, and it's a good
Yeah.
reminder. And I guess we haven't really talked about, but how it relates to workplace mental health. I mean, workplace violence and harassment prevention is part of the workplace mental health priority, as identified in the system for the province of Ontario, and the stress about violence and harassment is also a factor in people's health too. So fear and working in fear and that kind of thing. So we need to,
Absolutely.
we need to keep all that in mind.
Yeah.
So
Well, and
thanks
I
a lot.
think, making the connection a little bit is, people are not coping very well at the moment. There's so many different stressors that exist, not just work related, but with financial stress and different conflicts and politics and, cost of living, all of those things. So when we're already sort of living at this elevated level of stress, then when things happen in the workplace or we're in situations, we're not coping as well. And I think that's why through the pandemic, and there's lots of reasons, but that we started to see an increase in workplace violence and harassment is because people are just not able to, regulate their emotions as well. They're saying and doing things that maybe they normally wouldn't,
Yeah.
because we're kind of living up here right now with all of those various stressors that exist in the workplace and outside of the workplace. So absolutely, it's all connected.
Yeah.
And I'm sure Kathy's going to touch on that as well. I did put my email address in the chat. So if anybody is looking for additional resources, different workplace violence risk assessment templates, or just have questions, please don't hesitate to reach out. We're here to help and support.
Great. Thanks a lot, Kristy.
Okay.
And we'll definitely have you back next year to show us the pilot, and maybe
Yes,
we can
please,
engage
please do.
our audience